Hi everyone. For those of you who I've not had a chance to meet, I'm Marge Mantoni, the CEO of the Loomis Communities. I would like to first thank you all for the amazing dedication you have shown to each and every one of the residents, families, and to each other during this very difficult time. No one could have predicted where we would be this year, the losses so many have experienced, the fear and the uncertainty surrounding this pandemic. Today, however, we are here with Dr. Joshua Mintz, the medical director for all of the Loomis Communities. Dr. Mintz has been with us every step of the way during this time, and we could not be more grateful for his guidance. As you are aware, residents and team members of the long-term care communities in Massachusetts have been identified as top priority to being able to access the vaccine at this time. Many people are not sure if they are comfortable getting vaccinated or not. We are here to ask Dr. Mintz a few questions that we have heard from you all to hopefully help you decide if getting the vaccination at this time is right for you. So I'm going to start by just asking Dr. Mintz a few questions, and hopefully this will help you when making your personal decision. So we're going to start. Dr. Mintz, will you please just start by saying, would you or would you not recommend getting the vaccine at this time, and why or why not?
Sure. I wholeheartedly recommend getting vaccinated. Vaccinations and antibiotics are easily, arguably, the two most important breakthroughs in medicine in history. Antibiotics treat active infection, and vaccinations help prevent spread of disease. Throughout history, we've been able to manage everything from polio to smallpox, measles, mumps, rubella, diphtheria. We keep these in check, and in some cases actually eradicate the virus from the planet. And when we don't vaccinate, we see outbreaks that occurs internationally. As far as specifically with the COVID vaccine, it's an mRNA vaccine, which is the creation of a protein that the body then gets to recognize and fight off before it actually sees live virus. There's no potential for this vaccine to mutate into something that could actually infect you and give you COVID-19. What it does is it gives you the protection against exposure. So when you are exposed to COVID-19, your body has already, in essence, been able to create antibodies against what that protein, that virus looks like, and prevents it from getting into your body.
So you're saying that if we get this vaccine, which it appears that the Loomis Communities is getting the Pfizer vaccine, we're not actually getting COVID put into our bodies?
No. You're getting, in essence, a piece of a protein that is similar to the proteins that are on the virus itself that allow it to enter cells. There's no entering of the host cell, of the body cells with the virus.
So, a personal question. Have you been vaccinated?
I have, yes.
And how did it go?
It was fine. I get vaccinated yearly for influenza. And it's a normal injection. There's a little more localized discomfort after the injection than with something like a flu vaccine. For me, it was a muscle ache that lasted about 24, 36 hours. And then it resolved without issue. It's not uncommon to potentially have body aches, headaches, maybe a low-grade fever, and you can expect pain at the injection site as with any vaccination.
So are you because you got it yourself, were you worried that the vaccine has been developed too quickly? How could it happen so fast?
Well, that's a great question, actually. And the reason that this vaccine was able to be created so quickly, and quite honestly, it's the absolute best news we could have is having a vaccine against this right now. It's so desperately needed. But the research that went into the creation of this vaccine is taking advantage of everything that's been done in the fields of virology and vaccine research over the past 20 years to bring this to market so quickly. And this is the fastest vaccine to come to market. But again, it's relying on all of the work that's led to it. there have been no significant side effects that we know of from getting vaccinated, as opposed to getting COVID, which obviously has potentially life-threatening consequences.
And potentially they're starting to see long-term side effects, even if you get it and thankfully survive.
That's absolutely true, that getting COVID and recovering from COVID, we still don't know the long-term effects of being infected.
You know, it's always a worry. So this, you know, I think a lot of people are worried about what are the long-term side effects from the vaccination. And quite honestly, we don't know because it hasn't been out long enough. But it's really weighing the risk of maybe there's a long-term side effect. We don't know if there are or not, versus the potential long-term side effects that they are starting to see from people who have recovered from COVID.
That's absolutely true. Yes.
It's somewhat of a crapshoot.
Well, from a risk-benefit analysis, the risks of the vaccine appear to be very, very low. I mean, whenever you're vaccinated, there's always the possibility for an adverse reaction or even an anaphylactic reaction. People have allergies. We're not seeing that. There was one potential case out in Boston where a physician was vaccinated and he felt like he was starting to have an anaphylactic reaction, which he had experienced before with another allergy. But that's highly, highly atypical compared to the known risks of COVID. And again, long-term risks, we're still unsure for COVID-19.
And, you know, when you talk about the anaphylactic reaction, you and I have talked about it because I have a shellfish allergy. Mm-hmm. And so I asked you, should I get this vaccine? And, you know, share with the group what you told me.
Well, at this point, yes, absolutely. It's not a contraindication. When you're vaccinated, it's within a healthcare setting. And so if there is an adverse reaction, there are people there to treat. And so, and again, you're getting protected against the virus. Now, I do understand the concern about how quickly this has come to market. And yes, it's building on all of this research. This is an emergency use authorization. And it's done because of what we're facing, you know, as a global community. And there are always concerns because this is an unknown. This is information that we'll gather over time. But again, all the information that we have to this point is showing how efficacious and beneficial the vaccine is.
It's interesting. I have a friend from college who is developing a treatment for pancreatic cancer. Mm-hmm. It's a little shocking if you knew this guy when we were in college that he's actually doing this. It's really amazing. And we talked about this. And he said he's been doing his project for 7 years. The first 6 years were about trying to find funding, mm-hmm. which we didn't have to do with this vaccination. And he said the second thing that's challenging is you have to have a large enough group of people who are impacted by, in his case, pancreatic cancer, to be able to test. And what he said was, with COVID, unfortunately, we have a giant population of people yes. that we can test against.
Absolutely. And in the trials of the vaccines, and the vaccine did go through all of the stages. Again, there's an amount of time that necessitates using this under an emergency act.
So when you talked about risk reward, why would I take the risk of having a vaccination when I probably wouldn't get very sick even if I did get COVID? And I would just feel like I had the flu for a few days and recover.
Mm-hmm. Well, you can never know the outcome when you're infected with COVID-19. There are certain subsets of the population that are at lower risk than other parts of the population. But really, anyone who gets it is potentially at risk for this hyper-inflammatory reaction, which is what's so severe, which is life-threatening. And it can happen in all age groups. And again, we also don't know the long-term effects of being infected. Even if you have mild symptoms now, what does that mean further down the road?
Right. So why don't I just wait for enough people to get vaccinated so then we get herd immunity and the virus goes away?
Well, it's going to take a considerable amount of time to get to that stage of herd immunity. Right now, we need to, which is why we're rationing the vaccinations. I mean, not everyone who wants to be vaccinated can get vaccinated right now. And there's a tremendous desire within certain parts of the population to get vaccinated, even though they're not quite in the risk group that would give them access. So we're having to ration, and we're having to create stages within the population as to who's most at risk, who do we need to be vaccinated to try and prevent spread, and then we just go down the tier system depending on supply. So again, as soon as it's available to you, I would suggest getting in line for the vaccination.
If I get a vaccination next week, can I stop wearing a mask and stop worrying about social distancing and get back to my life?
Unfortunately, no. That would be great. The vaccine has up to a 95% success rate in creating an immune response, which is well beyond what we ever could have hoped for. But that still means that there's a certain subset of that population that will get the vaccine and yet still be able to contract the virus. We also aren't sure about after vaccination how long it will last, because that's something that that's information that'll come with time. So unfortunately, it doesn't change the need for wearing protective equipment, and it doesn't change the need for getting tested either. So even after the vaccine, we're still going to be testing, and we're still going to be wearing protective equipment until we get enough data showing that it's safe to decrease that level of concern.
I also heard that even those people who did contract it after being vaccinated became much less sick.
Again, you're talking about people that have been vaccinated and then come down with COVID after the vaccination. In the trial group. So yes, there's limited data on that, but just from a scientific perspective, it makes perfect sense that the body's been exposed to something, and even if it's not creating the level of immunity to prevent the virus from replicating inside our bodies, we have a jump start in fighting it off.
We have had a couple of team members say, can a 17-year-old get vaccinated? We do have some team members that are under 18. Would you say that that's safe? And are there any people that you would recommend maybe talking to their physician before getting a vaccination, or any group of people that might want to, just double check?
Sure. I mean, so the Pfizer vaccine has been approved for 16 and above.
Okay.
So 17 is able to get that vaccination.
Wonderful.
And what was the second part of your question again?
Are there any people, is there anybody that you would recommend maybe checking with their doctor, or any particular groups of people that might want to find out from their own physician first?
Of course, and for several reasons. One, again, what we were talking about before, if you have a health condition that may interfere with your body's ability to create an immune response, people that are on medications potentially being treated for cancers where they're immunosuppressed, if they're on medications that are trying to control an immune response, people with rheumatoid arthritis that are on immunosuppressants. There may be certain medications that make it harder for your body to respond to the vaccination. And again, women that are pregnant or breastfeeding should talk to their doctors before as well. The other important thing, though, is that there are certain medical conditions that put you at increased risk for adverse outcomes if you get COVID, and you may get moved up on the list for getting vaccinated depending on comorbid conditions. People with asthma and diabetes, and maybe because they're at higher risk, may be have better access to getting vaccinated.
So you're not saying that people that are pregnant should not get vaccinated, but they should just check with their doctor
Yes.
first? and make sure that they feel comfortable.
Absolutely. And again, and that's with all medical conditions. If you have any concerns, please bring it back to your primary care physician.
So this has been wonderful. I've asked all the questions that I've been hearing from our team members and even resident families as we've been talking to them about whether or not they're going to sign up for Monday, January 4th at Loomis Lakeside at Reed's Landing. We're really excited for those team members who are in that group of people who can have early access. But is there anything else that you think that I missed or that you think is important for us to know?
Well, I just want to emphasize that the fact that the entire world, all the labs all over the world, were working on trying to create this vaccine to deal with this specific virus and how quickly it's come to fruition, and the excellent results that we're seeing as far as rates of inoculation, that we couldn't have hoped for anything better than this. This is truly a scientific home run, and it truly is a godsend, and we should be thankful that it exists, and we owe it to ourselves and our family members, the people we work with, the people that we take care of, to make this happen as quickly as possible.
Thank you. I can't agree with you more. I know when we got our first data for our first clinic, we were cheering. We're so excited. So thank you so much, Dr. Mintz. This has been incredibly helpful. I hope that this has been helpful to each and every one of you as you make your own personal decision. Again, we're thrilled to be able to offer this opportunity to so many people at Loomis Lakeside at Reed's Landing and within the Loomis communities over the next month or two. We're starting to hear about dates for our other communities, and we're really excited about that. So we look forward to getting everyone vaccinated and putting this pandemic behind us, and as soon as possible. If you have any questions about this, see your health services director, Tamra or Patty or Lori or Maureen or Rob, or give me a call at extension 5174. And here's to shots.